A frequent sexually transmitted disease is pubic lice, often known as groin lice. The pubic louse usually nests near the infection site, only in the groin area, which is the outer groove that connects the lower part of the anterior abdominal wall with the groin, and usually includes the external genitalia. However, it can spread to people with thick pubic hair, the anus area, and the thighs. Armpits and facial hair are sometimes affected. The illness can spread to children's head hair and eyelids. Symptoms of pubic lice. The following are the symptoms that the patient is experiencing. Itching in the affected areas, particularly around the pubic region. The little bluish dots that make up the rash can occur on both sides of the body or on the front of the thighs. Itchy skin causes scratches. Pubic lice causes and risk factors. This louse is commonly transferred during sexual activity, but infection can also occur when you are in close proximity to a sick individual, such as sleeping in the same bed as him. Because the adult louse cannot survive outside of the human body for more than 24 hours, transmission through clothing, towels, and toilets is typical. It is worth noting that, as with all sexually transmitted diseases, louse infection can occur alongside other sexually transmitted diseases. Hazard factors. The following are the most significant factors that raise the chance of infection. Having multiple partners for sex. Having intercourse with someone who is diseased. Sharing a bed with someone who is diseased. Gay. Pubic lice complications. Pubic lice complications include skin itchiness that is intense, infections of the skin, lymph nodes enlargement, fever. Diagnosis of pubic lice. Many lice eggs can be found lodged in the pubic and buttocks hair after a thorough physical examination. The egg remains connected to the same spot on the pubic hair. The closer the egg's attachment point is to the pubic hair's tip, the older the injury. Because lice can be spotted as brown or yellowish-gray spots firmly adhering to the skin or hair, the remainder of the body's skin and hair should be inspected. Treatment for pubic lice. Pubic lice treatment aims to eliminate lice in their eggs. To prevent cross-infection, both couples must be treated, but other family members do not need to be treated on a regular basis. Among the treatments available are 1. Piperonyl-butoxide pyrethrum. The affected area and surrounding pubic hair areas should be wet, applied, and left for about 10 minutes before being washed thoroughly with warm water and soap and thoroughly dried. The pubic hair should then be combed with a thick toothbrush to remove any dead lice or eggs. Thighs, body hair, and underarms should be treated by those with thick hair. To destroy any lice that hatched from the eggs that survived the first treatment, repeat the procedure a week later. 2. Shampoo with 1% lindane. The procedure is the same as before, with the exception that the drug should be applied to the body for 5 minutes. A week following the initial treatment, a second treatment is frequently advised. A recurrence of pubic louse infestation could be caused by an untreated husband or wife, a fresh infection, or poor therapy. 3. Petrolatum cream. To treat lice on the eyelids, apply a layer of petrolatum ointment and comb it twice a day for 8 days using a thick-toothed comb. Clothes, bedding, and towels should be machine cleaned and dried, or ironed thoroughly. Pubic lice prevention. The following are some strategies for preventing pubic lice. Having sex with more than one partner is prohibited. Before having intercourse, use a condom. Underwear should not be shared.